All right, we can get started. I want to thank you all for joining us tonight for week 8 of our coaching conversations with Bay State Physical Therapy and MCR Chiropractic. Tonight, they'll be discussing injury prevention tips for common soccer injuries. And now I'm going to hand it over to Steve Windwer, Bay State Physical Therapy's and MCR Chiropractic's president and CEO.
Thank you, Jamie. I just want to, first of all, introduce myself. I'm Steve Windwer. I'm the founder and CEO of Bay State Physical Therapy and MCR Chiropractic. I am trained as a physical therapist and a chiropractor. Been involved in youth soccer with all my kids for a long time. And we're really just very proud to be part of Mass Youth Soccer as the official physical therapy and chiropractic partner. This opportunity is really exciting to us because first of all, it's an opportunity to work with athletes in a preventative way. I think when most people think about going to a physical therapist or a chiropractor, they think of them post-injury, after you've been injured, and to get out of pain and get back to functioning, which of course we're terrific at that. But really, we want to move the profession forward, to look at athletes in a different light, and we want to be there for preventing issues before they even happen. And certainly looking at potential weaknesses and predispositions to injuries. So we've developed a number of screening tools to screen the 4 most prevalent injuries that we see in soccer. And what we're going to be reviewing with you tonight is what we're doing with the athletes at our local partnerships and at the larger tournaments out in Lancaster. We've received great feedback from these screenings, so we want to be able to share them with the coaches so that you guys have a better understanding of what we're trying to do and how we're looking at the athletes. As clinicians, we help identify weaknesses and assess what strengthening exercises are necessary or what we recommend if the athlete would benefit from additional therapy or chiropractic care. So our goal really is to help you and your athlete stay healthy and injury-free to compete all season long. Tonight, we have 4 of our clinicians here today to describe the 4 main injury types in soccer athletes, the 4 most common injuries, and how we screen for these predispositions and help with injury preventions. What I'll ask you all is, if you have questions, to write them down, just take a note of them. What we're going to do is save all the questions for the end of all the sections, and then we'll do kind of a big Q&A. I'm going to pass it off to our first speaker, who is Ben Rose. He's one of our physical therapists in our Cambridge location. He's a managing partner, and he's going to talk to you guys about hamstring strains. Ben.
Thank you, Steve. As Steve said, I'm managing partner for our office in Cambridge. We're located right in Central Square, and we are partnered with Somerville Youth Soccer. So we've really enjoyed the partnership and are looking forward to kind of building our relationship with the local community and in the local soccer community, and getting to work with these athletes. One thing that we see in a lot of high-speed sports is hamstring strains and hamstring pulls, and occasionally tears. These are very common injuries because of the explosive nature of running, where we quickly extend through our knee while flexing through our hip. And those 2 motions put a combined stretch on the hamstring. And that muscle has to work to control both our pelvis and our distal leg. And what we see with a lot of athletes is that they'll frequently kind of be sprinting and pull up and stop. These injuries account for probably about 5 to 15% of soccer-based injuries. I think it's something that we see most commonly in developing athletes around here. As they're growing, sometimes their hamstrings are struggling to keep up with their bone growth and aren't able to stretch and lengthen as quickly as possible. And with that, we'll notice that this risk increases about 4 times due to muscle weakness and strength imbalance. So it's something that we can easily pick up on. It's something that we can screen for very quickly and effectively. And what we'll use is the unilateral hip bridge endurance test. When it comes to screening, it doesn't get much easier than this. What we do is we have the athlete lie on their back. They bend up one of their knees with their foot flat. They lift their other leg up in the air. And what we say is, I want you to push through your foot, lift your hips up off the ground. And you're going to hold that as long as you can. We look for any asymmetries, if their pelvis is twisting or rotating side to side, if they have trouble, maintaining control through their core. And the goal is to be able to hold this for at least 30 seconds. based off of the literature that we have, if it's less than 30 seconds, there's an increased risk of injury. I will say that I personally look for the ability to hold it for longer than that. Up to a minute is great to see, and often is an indicator that the athlete is strong and will be able to handle the stress that's put on this muscle. So once we do the screening and we find a deficiency in hamstring strength, we would then dive into a couple different exercises that we would be able to give out to the athlete and their parents, so that they can go home and start to work on building back the strength. These 3 exercises that you see here are definitely not the only 3 that we would recommend, and we definitely think that the more comprehensive assessment that you can do, the more detailed of an exercise program you can get, would be most effective. But we wanted to be able to give you guys some baseline exercises to be able to refer back to. So on the left side of the screen, we have the pelvic bridge with isometric hip adduction. This is a combination motion of it's closed kinetic chain. So you're pushing through the feet while squeezing the ball and lifting the hips up. The hamstring muscles, there's 3 of them that attach at the sit bone and go down to the knee. They work functionally with our adductors. So what we're doing here is we're including hip adduction so we can work on training a group of muscles that are most useful for building strength and reducing injury. The next one is a little bit more targeted towards one side, so a little bit more challenging. It's on an unsteady surface, so we're on a half ball. We're doing a single leg bridge. And then the third exercise is a core exercise. And one might say, why is that in there? Well, core stability is key in all of running and all of sport. And what we know is that the stronger your core is, the better able you are to really isolate the hamstring, and the less likely it is to get overworked. So these are just 3 exercises that can quickly be given to an athlete, and we can work on building strength from the get-go, but definitely not the only thing that we would recommend. So next up, I'm going to hand off to Adam Sorif, who will run you guys through knee and ACL-based injuries.
All right, thank you, Ben. My name is Adam Sorif, and I'm the clinic manager at Bay State Physical Therapy in Methuen. We've been fortunate to have treated a number of middle and high school athletes over the 4 years we have been part of the Methuen community, and we really look forward to continuing the partnership with the Methuen Association. So ACL injuries are the most common knee injury in sports, accounting for at least 50% of all knee injuries. When athletes injure their ACL, they often require surgery and then a subsequent lengthy post-op rehab. So research shows that when an athlete does undergo this surgery, they should wait a minimum of 9 months and oftentimes up to 1 year before returning to full sport participation to limit their risk for re-injury. So this lengthy time away from the team and the inability to play can have an emotional toll on a young athlete, especially if they're in their later years of organized sport with no plan for advancement to the collegiate level. So injury prevention can be critical for the young athlete's emotional health along with their physical health. And female athletes are at a higher risk for ACL injury at about 3 times compared to their male counterparts. So while all athletes benefit from injury prevention, it's especially important to identify these risk factors for female athletes. Preventative screening followed by a targeted exercise-based prevention program can reduce injury rates by 27% and ACL injuries specifically by more than 50%. And then another way to minimize this risk for injury during play is to properly warm up prior to games. So if any of you are unfamiliar, there's something called the FIFA 11 Plus, which is a complete soccer-specific warm-up routine and should ideally be performed prior to practicing games. It has been shown to reduce knee injuries by 77%. So it's very common for young athletes to focus solely on practice and games, and very often there is a gap in knowledge about injury prevention among the athletes and their families. Kids have a lot going on these days, and strength and conditioning is often disregarded, especially if they haven't been injured before. But just because they haven't been injured, it doesn't mean that mechanical faults or underlying impairments are not present that could lead to future injury. So to minimize the risk for ACL injury, we observe movement patterns, identify impairments, and then prescribe a patient-specific intervention based on our findings. For these young athletes, we can screen areas that are commonly associated with ACL injuries that include, but are certainly not limited to, leg strength, ligament stability, balance, landing mechanics, and neuromuscular control. So based on what we measure and observe, we'd be able to educate the athlete on our findings and give them exercises addressing any impairments that we find. So the exercises we have here are for basic core, balance, and leg strengthening. This first one here is a plank with an alternating leg lift, and this is focusing on core, hip, and the quads. A walking lunge focuses on leg strength and hip control. And then a single leg squat on a pad is a challenging exercise that focuses on single leg strength, balance, and neuromuscular control of the leg. Of course, these exercises can be progressed and regressed based on the athlete's fitness level, which is critical for tailoring a plan specific for the individual athlete. So for now, I'm going to pass it on over to Molly, who's going to talk about ankle sprains.
Hi, everybody. I'm Molly Fredrickson. I'm a physical therapist at the Beverly office. And I'm also a board certified pediatric clinical specialist with a special interest in adolescent athletes of all abilities. I've had the pleasure of working with multiple members of the Beverly soccer teams, both at the local town level and in the club level. So what we know and what we see about ankle sprains is we know that there's some of the most common sports injuries across all sports. Especially those that involve quick changes in direction that puts athletes at the highest risk because they have to stabilize their ankle, moving at high speeds, changing directions. And soccer is one of those sports, along with basketball, volleyball, and dance. And what we know about ankle sprains is that it's an overstretch injury of the ligaments that connect all of the bones in the ankle. And this can be anything from your athlete who's constantly rolling their ankles throughout practices or games to that athlete who has a really bad fall and has to go to emergency services right away. And these tissues don't unstretch. So especially that athlete who's repeatedly rolling their ankle, they'll end up with a more unstable ankle, which will place them at a higher risk for increased sprain later on. And we know that people who suffer ankle sprains during youth sports will end up with reduced sports participation, poorer balance, an increased fear of pain, and reduced function later in life as well, which, similar to ACL injuries can result in decreased fulfillment and happiness in their daily activities if they can't participate in the sports that they want to participate in. We also know that 27% of ankle sprains that are reported occur in children and teens underneath the age of 18. So we really want to make sure that we're sort of stepping in and helping them where we can so that we don't end up with all of the things that we see later in life. And lateral ankle sprains, anything on the outside of the ankle, are 85% of all ankle sprains. So when we're looking at our screens, we look for initial balance and ankle strength to see what their stability is, both when they're standing in one spot and when they're moving, so that we can provide exercises that are geared towards each athlete's individual performance. So if they're already having difficulty sort of standing on one leg without moving at all, we know that they're going to have a little bit more difficulty trying to stabilize while moving really quickly. So the screening tool that we use, is we know that decreased ankle mobility and especially range of motion into ankle dorsiflexion, bending their foot with their toes coming more towards their shin, will increase the risk of an ankle sprain when either living their life or during sports. We look for that range of motion in their ankle. And so with this screen that we have, the weight-bearing lunge test, we look for either asymmetries, differences in their ankle range of motion, or a like 2.5 centimeter difference between the sides. So then the exercises that we do after we look at this screen, as well as hip strength, spatial and body awareness, and the balance and the ankle strength. Some of the exercises that we do involve stabilizing their foot and their leg while moving their body over it. So that will challenge their body in some positions that they have more control of, that reproduce some of the things that they'd be doing while engaged in a game, such as having to shift their weight forward to back, side to side while balancing on one leg, adding in a hip hinge, or performing like a pistol squat. And so I'm going to pass it on to Dana for concussions.
Okay, so my name is Dana Pemberton. I am the chiropractor at our Attleboro location. Beyond that, I do have a extra certification that is called a Certified Chiropractic Sports Physician, which is a really fancy way of saying I am a sideline doctor all the way up to the professional level as far as athletics is concerned. Concussion is one of those hot topics right now that obviously I can't cover within 5 minutes of time, especially when we're talking about a teenage level population. The biggest thing with concussions in soccer in particular is that it's player to player contact, but there's also a cumulative effect as far as headers are concerned. We always have to be worried about our midfielders and our defenders who are constantly and consistently getting headers from maybe a goal kick or a sweeper or stopper who is at the further end of the field and doing a very aggressive kick to try to get it to the opposite end of the field. The biggest thing too, though, that coaches have to be concerned about is that the majority of these concussions are actually happening during the practice versus the game situation. And a lot of the times these players will, in the easiest way to say it, will hide it. About 50% of the population that are getting these concussions are going to return right back to play. They figure out a way to get around it. They don't realize it's that big of a deal. It may be a mild concussion versus obviously a severe concussion. They couldn't hide as much, but they're going back into these games, and then we have risks of more serious things with double concussion syndromes and things like that. The biggest thing that I always tell coaches to look out for, especially coaches of the female soccer players, is they are more likely to get the concussions versus the male soccer players, just because of the nature of the beast of our muscular structure, especially the deep neck flexors, which is what I'll talk about in our test next, is where they're losing that kind of strength in relation to the male counterparts. So this is the quick, easy sideline test that we can do with these athletes to see how strong their neck is, to be able to combat the potential of a concussion happening in game or in practice. The main focus is the shoulders are flat up against the surface, whether it be a table, or you can even do this on the ground. And what they do is they do a nice chin tuck, and then they lift their head up off that surface. The goal is for them to be able to hold it consistently. For a female athlete, roughly around 30 seconds is what we're looking for. And for their male counterpart, about 40 seconds. We really want to see that nice strength, because not only will their neck strength be able to help kind of that mechanism of injury with a whiplash that we get for concussions, but it'll kind of help dampen that activity. So next, what I can go through with you are some kind of preventative exercises that we can do and show these athletes. Most of it is really focusing on the neck and the upper back as far as getting some strength in there. That's where that extension comes from. We want to be able to go through all these ranges of motion with these athletes. I mean, and in general, as far as a concussion is concerned, the more strength to be able to rebound that whiplash, the better off these kids are going to be. The same thing with side bends. We want obviously all around the neck and through the head, and as well as that flexion, that big neck muscles right here in the front that'll kind of combat that big whip back. Essentially, what we're trying to deter these players from is having that big head whip back and then that forward come in order to prevent the brain from being sloshed around, essentially. And I am going to give this back to Steve Winwer, who is our CEO, to close everything up for us.
Thanks, Dana. There was a lot of information in a short amount of time. I'm sure there's plenty of questions, so I will open it up to Jamie to kind of and Aaron to kind of quarterback any questions for any of the specific speakers, and we can we've got plenty of time for a Q&A session.
I don't see any questions in the chat, but if anybody in the audience has any questions, if they either want to unmute themselves and introduce with the question or enter it into the chat function, I can definitely relay the question to our presenters.
I'll start off. I do have one question, or maybe possibly two. A lot of you have mentioned that females have a better rate of almost getting injured just due to like body type and muscles, and specifically the knee injury. So the first question would be, what activities would you recommend to coaches and players and parents of female players to help avoid these injuries? And then question two would be, what age should these activities start and how often should they be done?
I can take that. So when it comes to ACL prevention, it really does depend on the athlete themselves. So when you said about it'd be a lot of hip strengthening, things like squatting or jumping or whatever it might be. And then also a big thing is really form and technique. So, every kid is different. Both male and female athletes have different body types and different strength and different abilities. So, unfortunately, it's hard to just nail down specific exercises, but it would be sort of basic hip strengthening, core strengthening, and stability. And that can start, as young as if we get in the clinic, for example, here we've had kids as young as, late elementary school who are athletes and have some kind of knee pain or back pain. And, we do resistance training. And it's nothing very heavy, but it's what works for them. So you could be as young as, I've had patients as young as 9 and 10 years old and, doing exercises, strengthening, probably like 3 times a week, 4 times a week, but it does depend on sort of the individual athlete.
I can also add to that too. What we do know is that the highest risk for female athletes for knee injuries is around when they hit puberty, when their hips begin to widen and their knee angle changes. So keeping an eye on that and definitely tracking that as well can help prevent knee injuries in this population.
Aaron, do you want to tick through the Q&A?
Yep, absolutely. So one of our first questions here is from Mark Dewan. He asks how to help kids playing with growing pains, specifically in their knees.
Molly, you want to take that?
Yeah, definitely. So a lot of times the knee pain, if it's something like Osgood-Schlatter, where the growth plate on the knee is irritated itself, and that's leading to like that bump on the front of the shin that kids will get sometimes. It's from having their bones grow faster than their muscles, which is happening with most adolescents during puberty, but especially with our athletes who maybe aren't doing their quad stretches enough or are overusing their quads. So it's just constantly pulling on the growth plate. You want to make sure that they're still stretching through everything, especially quads and hamstrings, as well as doing a lot of leg strengthening in and of itself as well. The good thing about them is that they are self-limiting. So once the adolescent stops growing, it's easier to catch up with a lot of it and get the muscle length back again. But being a lot more strict with especially male athletes about the importance of stretching their quads and their hamstrings will help prevent a lot of the extra growing pains that they can get because the muscles are too tight to keep up with their bone growth.
And what about some home ice if they are having some pain?
Mm-hmm. Yeah, so you can use, my favorite is if you have like a plastic cup or a paper cup that you freeze in the refrigerator, then you can unwrap it and have something to hold on to. And you can put ice directly on the places that are sore, or if you have a nice large ice pack, you can wrap it all the way around the knee. You want to do it for about 10 to 15 minutes after activity so that it's not happening beforehand and stiffening everything up.
Great.
Thank you, Molly. Next question is regarding KT tape. They said, what about the use of supportive KT type tape? Ben, would you like to take this one?
Yeah, everybody's opinions differ on KT tape, but we have practitioners that utilize it frequently, and we have some that don't utilize it at all. It's one of those things that it's always worth trying out, and you know, if it's helpful, then awesome. It's an easy way to offload a joint to help increase blood flow, and if it doesn't help, then you know it's not a big investment. So I think it's another modality that we have to help growing athletes, and oftentimes I find that it's most effective for neuromuscular feedback and control. So giving athletes a sensation of the movement and being able to get that feedback, which often children struggle with, especially young male athletes who are growing, as we've been talking about, very quickly, in that proprioceptive feedback, that ability to sense their joints in space, the feedback that we're supposed to get from our tendons that allow us to know how stretched or how shortened our muscles are, is often a little bit delayed. So I speak to personally, I don't utilize it that much, but I've seen great success with it in many of the clinics that I've worked in previously, and some of my staff as well.
Thank you, Ben. Next question. Ben Myers had said great information, so thank you to the presenters. Would it be possible to get a copy of this presentation and any underlying materials indicating duration of reps and sets for the exercises? I can take this one. Ben, we will be circulating this presentation following this. So you'll be getting this from Mass Youth Soccer, and we also have a downloadable injury prevention guide that goes through all of the exercises and the information that we went through today. So you will have that in your inbox soon. Next question is, Dana, if you could take this, what is the most reliable way to check for a concussion?
Yeah, okay. So that's actually a little bit of a loaded question, honestly. A good portion of this is actually really just kind of getting to know your kids. There's also a baseline test that you can do previous to the season. They're called SCAT forms. They're a series of questions that these kids fill out. Beyond that, but a lot of it really is kind of getting to know your kids, knowing their personality traits, because some of it is little minute changes that you may not pick up on, as far as like irritability and things like that. If it's even a mild concussion can have those sort of changes as far as their actual personality is concerned. The easiest down and dirty way is literally just asking them either a series of questions that they know the answer to, and literally walk away from them and then ask them the same things again and see if they give you the same answers, or telling them 3 to 5 inanimate objects actually, and then walking back about 5 minutes later and asking them to recall those same things that you just told them to hold in their memory for you. The short-term memory is where we're going to really see the concussion shine first. But like I said, the biggest thing, honestly, normally what I tell coaching staff is really to kind of get to know your athletes very well, as far as a personality wise. That way you can pick up on these like minute changes.
Davis, do you have anything to add to that?
Yeah, that's great, Dana. Thank you. I think the other piece too is just, of course, if you were able to observe what happened on the field, obviously there's a blow. You're going to be a lot more sensitive if you see their head get hit, or they fall to the ground and hit their head, or if they fell without, but there was that whiplash type injury like Dana was talking about earlier. Personally, I like to ask a few questions too, where, related to the game that they should know okay, who scored the last goal? What's the score right now? Things like that, that they're part of the game, that most of these athletes are going to be able to respond really quickly. And then I like to pay attention to their speech too. So what I've seen is as they try to answer, it might be slurred a little bit, or they start to say something and then they kind of switch and their focus translates to something else. Lastly, their vision, asking, and this is part of the screening test that Dana was talking about as well, that, is there any blurred vision? And, just having them follow your finger with a simple tracking ocular motor test where they're moving their eyes, following your finger. If they can't do that, or they're off looking behind you as you have your finger in front of them, that's a great sign as well. And, just got to err on the side of caution. And if there's any belief that, this athlete, I saw what happened, maybe I'm not sure based on my test, then keep them out of the game. There's just too much that can happen, as Dana had mentioned earlier, with, possibly having a second concussion in a short period of time and having some consequences that could be much more severe.
So I didn't introduce Tom earlier. Tom is our VP of operations for our physical therapist, and he's also a vestibular trained therapist and has a lot of postgraduate degrees and has done a lot of work with concussion patients. So we're fortunate to have Tom on the call as well.
Thanks, Steve.
Thanks, Tom. Thanks, Dana. Next question is regarding the sets and reps of the exercises. Question asking, how does age, height, weight impact the number of sets and reps you would recommend for these preventative exercises? Adam, do you want to take that?
Yeah, I can take that. So I think that the age, height, all of that isn't quite as concerning as, say, the athletes' basically their fitness level. You can have someone who's a very fit and has some strength and conditioning at 16, and someone at 16 and they have none. So for me specifically, it really depends on, sort of how they do the exercise. We kind of maybe start with a sort of a general sort of 3 sets of 10 for a strength exercise. If they're shaking and they can't even finish the 3rd set, it might be too much, because you want to make sure that whatever they're doing, their form and their technique is good throughout the entire exercise. If they're texting and yawning while they do it, then it's too easy. So it really does depend. I think that with some of these exercises, starting off for strengthening would be like a 3 sets of 8 to 10, and then sort of assessing from there. If it's something that's more of a hold, like a plank or something like that, trying anywhere like the 20 to 30 second range. But again, it really does depend in making sure that their form and technique should be, and they're not compensating.
Thank you, Adam. Last question we have in here is regard to shoes. With the increase in number of turf fields, especially at the high school level, would it be wise to recommend turf shoes instead of cleats?
I can speak to this one, Aaron.
Great, thank you, Ben.
So there's mixed information on this, because there was a study done within the last 10 years where a group of researchers created a device where they could create a downward force and a twisting force. And they took cleats and they took sneakers and they put it on grass and they put them on turf. And the finding was that the machine wasn't strong enough to break the cleat from the turf, and it was quite strong. So there's some data that shows that the cleats that go into artificial turf are very hard to break loose. However, there's like demographic population data within the NFL and the NCAA that shows that ACL injuries on turf are not actually that much different than ACL injuries on grass fields. Which I found shocking, because I'm team turf cleats on, long cleats on artificial turf will lead to increased ACL injuries, and you see it all the time with the plant and twist, and it just looks like, especially in high level athletes who are super strong, the amount of force they create, you would think, okay, if you had just planted on grass, you would have just split out, right? So intuitively to me, it seems like one would recommend shorter cleats or turf shoes. But when you look at the research that we have, at least that I've seen recently, The data doesn't necessarily support that thought process. So it's a little mixed. And I think what would be really interesting to see would be ACL injury rates in the English Premier League and other parts of the world where they exclusively use natural grass. Because when you watch those games, and especially when it's wet, you'll see that these athletes will end up sliding when they're planting, which can create other injuries. So that there's two sides to the coin. But when it comes to ACL specific injuries, it seems like the artificial turf definitely leads to a higher incidence, but we don't really have a lot to support that. So it's hard to answer that question directly. But I think if we get some more data, and you guys might anecdotally notice it, it's something that would be worth testing out and seeing how your athletes move with the turf shoes. I know they're used in the NFL with linemen quite frequently, but they just aren't moving in the same explosive manner as soccer players. So it's kind of still up in the air.
Thank you, Ben. The last statement in the chat box was just that the turf shoes quality continues to lack for soccer players. So kind of speaking to some of your points there, Ben. Those are all the questions in the chat bot. If anybody has any additional, if you want to toss them in now or unmute yourself and chime in here.
I think one of the things that's often overlooked in a concussion is the impact to the cervical spine. I think when parents and coaches and even the athletes think about a concussion, they think, well, I have a headache and I'm dizzy and I don't, I can't think right. And they think about all of the, kind of the manifestations of a concussion. But quite frankly, you can't have a concussion without having some type of effect to the cervical spine. And as practitioners, certainly from the chiropractic perspective, and Dana can speak to this, or Dave Smith's on the line as well, and certainly PTs that do a lot of manual stuff, taking a look at the cervical spine and making sure the alignment there is also very, very valuable, and I think will lead to much quicker and better results in our concussed patients and athletes and kids as well.
I think that was kind of the point that I was trying to make with, as far as the overall strength that we're looking for in the neck also leads towards mobility. Obviously, we need both of those to get a healthy patient, and which is what we're looking for with these kids as far as preventing and obviously helping them after concussion. There is a huge genre of PTs and chiros who deal with a lot of post-concussion patients, because obviously they've lost that mobility, they've lost that strength, and we're trying to regain that back for them. But obviously in the preventative aspect, we're trying to help them get to a point where hopefully the after effects won't be a problem for them.
Thank you, Dana. One last question here. Jason Cormier asks, what does the data speak to performance sole inserts such as BK tri soles? Does that help with absorbing the knee/ankle shock?
So I think it's the Victory soles, and they're supposed to have an increased elasticity where you get more bounce and be able to jump higher and get more push off to be faster and things like that. I'm not sure of any data, maybe Ben, on those, specific or insoles for soccer players. One thing to be careful though with any insole into a soccer shoe is the amount of height that it may take up in the shoe. And if the shoe is still able to give the stability, the medial lateral stability that you still need with the insole in, and some of these insoles or lifts and stuff that folks, the athlete might have in their cleat, can change that and put you more predisposed for an ankle injury, especially if you fall into the screening that we talked about with the reduced ankle range of motion. You're going to be more limited with that in there. I know the Victory has become extremely popular with athletes. And I don't know if there's any specific research as it relates to ankle injuries or knee injuries. I'll turn over the panel if anyone else has heard anything on that.
I'm not aware of anything in particular. I'm sure that there's certain cases where it can be helpful, but I think at the end of the day, it's the ability to control, proximally and through your glute muscles with quad and hamstring strength as well, to be able to control that impact is what all the research supports. So these things can definitely help to be a step and a gap in between. But it really is, at the end of the day, it's catching these weaknesses, addressing them head on, and working on movement control. And then if you address all those components, then all the other things will, they'll help. But you really want to target the main causes of these injuries.
Ben, I think you just hit on a key item that sometimes is overlooked with the movement control. And so if you may have an athlete that's out with a sprained ankle, and they might be even non-weight bearing for a period of time, or maybe not, or maybe they were in a boot and they're released back to play and they haven't been weight bearing. They've lost what we call proprioception, that ability to have that movement control. And potentially what you'll see is, risk for more injury up the chain. And so you might see it at the knee or hip. And so it's important that you consult with physical therapists following injury, even if it's a mild ankle sprain, if you've been off it or you've had changes. Number one, to look at why did the sprain occur, if there's other predisposed issues there, or are you getting back to your sport in a time where you're the rest of that lower chain, your knee and hip, are in a position to react accordingly without having potential injury there as well.
Thanks, Tom. Those were all the questions in the chat. I'll hand it back over to Steve to wrap us up.
Thank you, Aaron. Well, just first of all, I want to thank all of our presenters for taking, a lot of time out of their long days already, seeing patients, and to do this. Certainly everybody that's on the call tonight, just really appreciate you taking the time to help your athletes prevent injuries. And we'll make sure we get the deck out to you guys, and certainly all the exercises. And again, we appreciate the opportunity to partner up with Mass Youth Soccer, and anything you guys need from us in a preventative treatment, whatever, we're here to help. So thanks so much. Everybody have a great night, and we'll see you on the fields. Night, everybody.